Hello, my name is Dr. Brandon Blood, and we are here today to discuss headaches. Now, headaches for some people can be very debilitating. Some people have daily headaches or weekly headaches. So what we want to touch base on is, and educate you on, is how do we identify the causes of your headaches and consider appropriate treatment options. Okay. Now, when we talk about these types of headaches, we're largely going to talk about what we would consider tension type headaches, muscle and joint tension. So let's first talk about some of the reasons we might experience headaches. Well, one of the most common things that I see on a day-to-day basis in my practice is postural related stress. And we can all relate to this, whether we're sitting at our desk for periods, whether we're looking at our phone or other devices for periods. We have a lot of postural strain on a day-to-day basis. And ultimately, now this is an animation to help kind of guide us through this, but ultimately as our head and our upper body hangs forward, we put due stress on different muscles and joints in our neck and our upper part of our body. So this muscle, for instance, is the sternocleidomastoid muscle, and we'll give an example of how this can cause headaches as well. But we're also going to trigger our trapezius and our upper back muscles that are commonly involved in daily headaches. Okay, so the worse our posture is over a period of time, we are subjected to these types of stresses in our muscles and our joints. Now let's break this down a little bit further and look at how muscle strain over a period of time can develop what we call trigger points. So a common trigger point, like I just said in the other screen here, is a trigger point in what we would consider our sternocleidomastoid muscle. So a trigger point is a focal area of spasm in our muscle that when we push on it can refer pain to other parts of our body. In this case, if you can see when we trigger this sternocleidomastoid muscle, it has a pretty wide area of referral pattern that we can experience pain in. So, for instance, this muscle, we can get headaches around the eye, which a lot of people will suffer from, maybe around the temple area, and we can even see it shaded in the top part of our head. Now that's just one muscle, and then there's a lot of overlap in different trigger points and how they refer pain. But we'll look at another muscle here. We'll scroll back to the back part of our head and what we would consider more of our posterior occipital musculature. So let's click on the back of the head here. So you can see when we get tightness even in the smaller muscles in the back of our skull here, you can see how it can and will refer and reproduce headaches around the top of our head, around our ear, and shooting right into the front of part of our eye. And these are just a few of the muscles, and there's a lot of that can be involved with this, purely from something as simple as bad posture, poor posture, that we're all subjected to over time. Now the other thing that we look at, in addition to the muscles, how joints, when we have restrictions and tightness in our joints, how it can refer pain into our head and our neck. So when we get restrictions in the top part of our vertebrae, at the base of our head and top of our neck, you can see too it very clearly has a common distribution of headache type symptoms. So we want to address, and this is where the complication comes from, because there's a lot of structures that can radiate and refer pain from our head, from our neck into our head. This is how headaches can be so complicated in terms of finding the right treatments. For some people it's medication that can help dull these symptoms, but it really doesn't do much by way of correcting your posture and restoring proper joint and muscle function. But ultimately what I want to do today is just give you an idea and try to explain why so many people have these common symptoms of headaches from something as simple as just postural strain over a period of time. I hope that you found this informational, and we will be posting more information on various symptoms. If you'd like, leave some feedback for us if there's any symptoms that you're experiencing that you would like us to explain.